And especially in the phase when there are no ischemic symptoms, and that continues to have that people have those ischemic symptoms, that's the phase that we can possibly identify those dissection-related events, because then they have, for example, with the vertebral artery, people feel unsteady, they have difficulties with talking, they have nausea, they have facial palsies, weaknesses in the upper and lower limb, all those kind of symptoms. These are not really normally associated with neck pain. And then we can identify these kind of symptoms. And then we know that when there is a dissection in the vertebral artery, the pain is mostly distributed in the upper cervical spine, also occipital headache, and also people always often say that there is an acute onset of the pain, and the pain is described unlike any other. So that's with regard to the vertebral artery. And when you look at the internal carotid artery, it's more or less the same, that people always often say that there is an acute onset of the pain, and also they have never felt that pain in the past. But then the pain is more distributed in the upper cervical spine region, and pain around the ear and the jaw. And also there's also head pain in front of their heads. And then people with a dissection, a carotid artery dissection, have also ptosis, that is the hanging upper eyelid. They have also weaknesses in the upper limb, facial palsies, also speak and those kind of problems, also unsteadiness and those kind of things. So it's always also difficult, because these signs and symptoms are also both present in dissection of the internal carotid artery and the vertebral artery. The pain distribution is different. The signs and symptoms, the ischemic signs and symptoms, overlap. So ptosis, you don't see ptosis often in the vertebral artery dissection, but it can be present in case of a vertebral artery dissection. So you cannot use it to diagnose, I guess. But those kind of symptoms are very important. And then one thing is good to emphasize, that although we say that people often have the experience that it is an acute onset of the pain and that it is their worst pain ever, we also know that in about 25% of the people, this is not the case. So you cannot conclude that it is a gradual onset of the pain, that it can't be in a dissection, or when they only say it's not my worst pain ever, you can't rule out a dissection, because in 25%, they show different features.